Hey folks, Dr. Gerstmar from Aspire Natural Health here. This week I wanted to talk about something that keeps us up at night, right? Anybody who's out there practicing whatever you want to call it, functional medicine, integrative medicine, natural medicine, it goes by a lot of terms. But one of the things that keeps us up at night is the cost and how that cost can keep people from being able to access the type of medicine that we do and the help that we give people. We know there's a lot of people out there who need help, and cost can be a major factor. So I wanted to talk about two ways that we can reduce the cost for this kind of work that we do. So the first thing we have to address is why. Why does this medicine, this way of working, cost more money? And there are really two reasons that it does. The first is that to have someone sit with you for an extended period of time. Remember, our average visit, first visit is usually an hour in length, and follow-ups are often 30 to 45 minutes long, a lot more than the average kind of 10 minutes or so that a medical doctor spends with you. And we have to have that time to practice this kind of medicine because there's so much more that we need to know about you, not just what are the symptoms. So frankly, just spending that extra time is one of the factors that costs more money. So I know for what we're doing here at Aspire Natural Health is we have a health coach involved now. So the health coach can extend that, can spend a lot more time at a lower price point and make it more affordable. So that's one way that we can help with reducing the cost. That would be the third way. We're going to talk about two other ways. But one reason this style of medicine costs more is simply because we need to spend a lot more time with you. The second reason that this type of medicine costs more is because of the testing. So while we often don't do, really expensive tests like MRIs, we're often doing a lot more and a lot more extensive testing than medical doctors. So thyroid is one great example. The average MD is testing your TSH generally alone, whereas when we're doing a thyroid panel, often we're looking at TSH plus all the hormones plus antibodies, a lot more extensive panel that costs quite a bit more money. And while it's going to vary wildly, it's not uncommon that people seeing functional medicine doctors are looking at paying somewhere between $400 to $2,000 and maybe even more for testing, which puts it out of the reach of quite a few people. So that comes to the two main ways that we can reduce the cost of functional medicine, both as practitioners and as people out there looking to get the care. And here's what they are. The first is guess, don't test. So we have a philosophy we try and live by most of the time, which is test, don't guess. Test, obviously, understand in detail what's going on for a person, and as much as we can, precisely what's going on for the person. So we can say, yes, you have digestive problems, but we can do a stool test and we can look and see, are you digesting your food properly? Is there a lot of gut inflammation? What do the bacteria in your gut look like? Do you have plenty of the good stuff that should be there? Do you have a lot of bad stuff that shouldn't be there? Do you have yeast overgrowths, candida, and other yeast problems? Do you have a parasite infection? So you see, we can segment down a lot more into what's going on when we say there's a digestive problem. Because some people with digestive problems won't be digesting their food correctly, and we need to address that. Others will have bacterial overgrowths, and we need to address that. Others will have SIBO, others will have fungal overgrowths, others will have parasites, on and on and on. And so that's why we like to say, test, don't guess. But when we're looking at how to make costs more reasonable for people, we need to flip that on its head and say, make educated guesses, don't test, or keep the test down to a minimum. So when people go to a doctor like myself and we're saying, well, you could do this test, this test, this test, this test, one of the answers is, well, what do we really need to do and what would be nice to do? And I can tell you, since thinking more deeply on this subject, I've been having those conversations more candidly with patients recently and trying to find that balance. So the first is make educated guesses. It is not always necessary to test. What this requires on your part, though, as the patient or as someone seeking this care, is more patience. So where we can test, see what the issue is, and then direct our therapies towards it, when we're making educated guesses, often more patience is needed because we're saying, hey, you have digestive problems, let's try this. And then we have to see, does that help? Do you see things get better? Do things get worse? Or does no change happen? And what does that mean? So it requires more patience on the part of people when we're making educated guesses and not testing. The second major way that we can reduce the costs is to cover the basics. So we can say, oftentimes we like to spin off into all these different areas, but it's really important that we look at the basics and have the basics been covered. If they haven't been covered, we can start there. If they have, were they done well and properly? And then is it necessary to go out into the other factors? So here are some of the basics. So is food in a good place, right? For a lot of people coming to this medicine, they've done a lot of work with food, but has the basics of food already been covered? So for example, have you done an elimination diet? Have you done it well and for long enough? And I thought next week I could cover more on elimination diets. But if it hasn't been covered, it's a semi-easy, right, but relatively inexpensive way to get a sense of how food is affecting us. The second is, how about the rest of lifestyle? Have you addressed your sleep, your exercise or movement patterns, your stress levels? If those haven't been addressed, then do the work there. The third would be mental and emotional issues. So have you looked, are there big mental emotional issues in your life that are causing issues with your health and well-being? The fourth we could say would be detoxification. Now we can do very specific testing to look more deeply, and you don't have to embark on some crazy regimen, but we're all exposed to a lot of toxicity in our day-to-day lives, and have you done some work to address that? The fifth would be treat the gut. So we talked about the gut. Yes, we can do stool testing, but it isn't necessary, and you can do a lot of work just by covering the basics of treating the gut. And lastly, we'd say, adrenal function, cortisol, the HPA axis, again, the other side of that stress response. Have these things been handled? So right now, if you're someone, you don't have the funds to see a functional medicine doctor, or maybe you're looking to go and see one and looking to try to economize, the first steps would be, have all of these pieces been covered? So you could deal with food, deal with lifestyle, take a look at mental emotional issues, do some basic work around detoxification, adrenals, cortisol, and do some gut work without really having to do any testing whatsoever. Again, you can do that on your own, or you can get a professional involved to help guide you through that process. But if we're going to make educated guesses and we're going to cover the basics, it does require some more patience on your part as well. All right, folks, I hope that's been helpful. So, 2 ways to reduce costs of functional medicine and make it more available to more people. Make educated guesses instead of doing a lot of extensive testing. Again, as doctors, we don't like that very much. We like to see the numbers, we like to see the specifics. But having said that, we can make some good educated guesses as long as there's patience and understanding on both sides. The second is focus on the basics. Make sure that these pieces have been really well educated. Again, food, lifestyle, mental emotional factors, detoxification, gut work, adrenals. If those factors haven't been addressed, then before we spin off and do a lot of testing or go into all these other areas, let's make sure the foundation, the core, is taken care of. All right, folks, again, I hope that's helpful. At Aspire Natural Health, we focus on treating gut problems, autoimmune diseases, and other hard-to-treat cases. If that's you or someone you love, please get in touch with us. We offer a complimentary call. We can find out if we're the right fit for you and you're the right fit for us. So if this approach resonates with you and you either want to get some testing done or you want some guidance to help you take you through those core pieces, please reach out to us. All right, folks, I'll be back on next week. I'm thinking of tackling elimination diets and food sensitivity testings. Which one should you do, and what are they good for? In the meantime, if you have any other questions that you'd like to see answered, you can leave a comment here in the comments. You can send us a direct message, or you can drop us a line with those questions, and I'm happy to add them to the queue and see if we can answer them for you. All right, folks, until we talk again later, take care.